Just as the flyby is completed, we're joined now by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health today. Doc, and it's great to have you with us. Today, Governor Baker said that the number of COVID-19 patients hospitalized is leveling, and I just looked at the latest percentage. It's 7%, and it's been kind of that way for a while. But it's not coming down. What are you seeing at South Shore Health?
Well, hi, Ed. So, yes, we're seeing something similar. The curve is definitely flattening. I think we are seeing a little bit of a decrease in new cases. But I think what's important is that the stay-at-home guidance that has really been at the center of our infection control measures have really worked to prevent the surge and prevented many of our hospitals from being overwhelmed.
Hi, Doctor. It's Maria. So the stay-at-home order in Massachusetts, as we have been reporting, it goes through May 18th. State information shows less than 4% of the state's population has even been tested for COVID-19. So what level of testing will make everybody comfortable to determine if that spread is even under control?
Okay, so Maria, it's an important question. I don't know that there's a specific number, but I think what's very important is that we want to ramp it up as much as possible. We want to make sure that that testing is focused to the most vulnerable populations. And then we want to make sure the testing can surround warm zones where we see a cluster. We don't want to have a hot zone. And in order to do that, we have to make sure that we're able to test and isolate, and also testing those asymptomatic patients are really important. That's what makes getting our hands around the testing so challenging, that asymptomatic patients can spread infection.
Massachusetts is focusing on expanding COVID-19 testing to gauge whether the larger population is positive or negative versus antibody testing, which determines whether someone has been exposed to the virus, picking up on the point you were just making.
Right.
Is one option better than another?
Okay, so remember, if you're testing for the presence of virus, if you have symptoms or want to see, do you have active infection, you want to use the swab testing. That's the PCR. You're looking for viral detection. If you want to know whether the population, how much penetrance or how widespread the infection is in the population, or as an individual, have I been exposed in the past, that's when you want that blood test for antibody testing.
A lot of people, Doctor, are asking, what are the barriers? What's stopping all of this to more expanded testing?
Well, remember, Massachusetts has a lot of people, and it's not just those that are symptomatic that may have the virus. You can, as I said before, if you're asymptomatic, you can still transmit this. So it's trying to really, make sure that we have enough capacity. We have the testing ability, but remember, there are problems with supply chains, the swabs, the viral transport media, even the tests, the actual machines that we use, they require ingredients that there is a short supply of. So getting it all together and coordinating it is very challenging, but I can tell you our leadership is trying to do as best that they can.
Dr. Ellerin, thank you so much for your insight as always. It's great to see you. Be well, sir.
Thanks, guys.
Be well.
Take care.
Thank you.